Thank you for an interest in the topic of a new corneal laser for age-related macular degeneration. This is very exciting technology that is showing significant benefits. At the Bochner Institute, we've been involved in many surgical innovations over time, including techniques of laser vision correction, a PRK in 1991, LASIK in 1994, corneal cross-linking for patients with irregular corneas like keratoconus. We started in 2008. And then in 2010, we introduced topography-guided PRK to improve the quality of vision in patients with irregular corneas. In 2012, the femtosecond laser for cataract surgery as well as for refractive lens exchange. And in 2018, a new corneal laser for age-related macular degeneration. By using a sophisticated laser, we treat 4 microscopic points on the cornea that change the curvature of the mid-peripheral cornea, and this directs light to the back of the eye to spots outside of the blind spot. By changing the cornea, the new light pathways can stimulate an area of functioning retina and vision can be improved. A process referred to as neuroadaptation results in improved vision over time. If the image falls on an area in the parafoveal or parafoveal areas of the macula, then there is the potential of improved vision. The topographic changes of the cornea show a quadrifocal change induced by the laser. The primary indications today for this new corneal laser are in dry and wet age-related macular degeneration. In December of 2016, I had the opportunity to travel with Dr. Sam Markowitz, low vision expert, Dr. Fatima Galani, retina specialist at the Bochner Institute, and Dr. Ghani Salim, clinical director of research at Bochner. We had the opportunity to observe patient treatments and follow-up visits on a number of patients that had this innovative corneal laser for age-related macular degeneration. What are the potential risks of this procedure? Well, there have been no reported complications in over 300 patients treated in North America. There's been no epithelial defects and therefore no risk of a corneal ulcer. The laser wavelength only penetrates just below the surface, and therefore there's no risk to the intraocular structures, the corneal endothelium, the iris, the lens, the retina, or the optic nerve. The very first patients that were treated with this innovative laser showed excellent results with a high percentage of patients gaining 2, 3, and 4 lines of vision and published in the scientific literature. How long can one expect the procedure to last? Well, the first patients that were treated for age-related macular degeneration have been followed now up to 4 years, and the vision tends to improve during the first 1 to 2 years and generally remains relatively stable at that point. Neuroadaptation is probably responsible for continued improvement of vision over the first few years. Why are the results better than simply wearing glasses with prisms? Well, prisms can direct the light only in one direction, and the laser procedure essentially has a multifocal or multi-prismatic effect. How is the procedure performed? Well, only anesthetic drops are used to freeze or numb the surface of the eye. There are no other preoperative drops. The patient sits on a motorized chair, which is then reclined. The laser, which is attached to a computer program with sophisticated software, is turned on and calibrated. The energy level of the laser beam is checked to be sure it's within a satisfactory range. A suction device with a built-in crosshair is then centered by the surgeon over the pupil. A vacuum is activated to secure the suction device to the front of the eye. The next step is that a probe that contains the laser beam is actually placed in the center of the suction device which locks in place using a series of magnets. The laser is then activated, which creates these 4 focal areas of corneal dehydration. The vacuum is then released and the suction device is removed from the surface of the eye. If both eyes are treated, then the procedure is repeated for the other eye. The patient is then checked immediately postoperatively to be sure that the 4 focal areas on the cornea have been successfully treated. This is a view of the cornea showing the microscopic white area of the affected treatment. The postoperative care is very straightforward since the patients don't require any postoperative drops or oral medications. Patients are typically very comfortable after the procedure, and the post-op visit, the first one is at 1 month, and then 3 months, 6 months, and 12 months. Well, why are the visual outcomes better than just simple magnifiers? Well, magnifiers simply enlarge the image onto the back of the eye of the macula. The laser techniques actually shifts the focus of the image to different retinal locations within the macula that have the potential to improve visual function and quality of life. We designed a clinical study at the Bochner Eye Institute to verify the early excellent clinical results of this new corneal laser for age-related macular degeneration. The clinical trial involved 74 eyes of 42 patients with bilateral dry age-related macular degeneration. All the procedures were done at the Bochner Eye Institute, and pre- and post-op assessments were done by the low vision specialist Dr. Sam Markowitz. Patients in this study had a best-corrected visual acuity of between 20/80 to 20/1600. The preoperative testing involved checking distance and near vision, utilizing the potential acuity charts, microperimetry to identify fixation parameters, and using computerized topography and tomography to identify curvature changes. The potential visual acuity test is one of the most valuable for determining the ideal patients for this procedure, where we check vision for both distance and near with a series of different size E letters. The results of the study were very positive in terms of no complications, significant improvement in vision. The range improved from 2 to 5 lines of gain. The potential acuity charts were found to be valuable as a screening device. And in addition to acuity improvement, the quality of life gain was significant as measured by sophisticated survey questions. In conclusion, I'd like to say that this new corneal laser for age-related macular degeneration has proven to be a safe procedure, can result in significant improvement in both visual acuity and quality of life. I do feel that all patients today with age-related macular degeneration and acuity worse than 20/70 in the better eye should be counseled about this exciting technology. The early results with wet AMD at the Bochner Eye Institute have been very positive as well. Thank you for your attention.